Good evening, everybody. I want to welcome everyone to the Scarborough-Guildwood Town Hall meeting. I'm here with my colleagues, MPP Mitzi Hunter and Mayor John Tory. I want to welcome both of you, and in particular, Mayor Tory. This is our seventh Town Hall. We've covered a variety of topics from health, education, community services. So it's a pleasure to have you joining us here this morning. Unfortunately, John McKay, our member of federal parliament, is unavailable this evening. He's chairing a standing committee on Parliament Hill, so he won't be able to join us this evening. But I want to welcome both of you. And would you like to say a few words, Mayor Tory, before we start?
Well, I'm pleased to be here with Paul, my colleague on City Council, and with Mitzi, who I've had a long association with through Civic Action and otherwise as a member of provincial parliament and minister. And I hope tonight, I know many people will want to talk about COVID-19, and I'm happy, of course, to talk about that and everything that comes out of that. But I'm also quite happy to talk. I mean, the business of the city has gone on. We're still addressing affordable housing. We're still addressing the transit priorities of the city, including in Scarborough. We're addressing a host of other things, as you know. And one of the big challenges for us during the COVID-19 period has been to keep city services going so that people could continue to live their lives in as normal a manner as possible, recognizing it's been pretty abnormal. I should just tell you, and I don't say this about everybody. You'll think I just come on to everybody's town hall meetings, but Paul Ainsley has been someone who has been a valued colleague. He not only sticks up for the people of Scarborough and talks about their needs with respect to transit and housing and a host of other things, but he chairs a committee down there that is actually, in a way, it's sort of the catch-all committee where a lot of things go, including, for example, a lot of our initiatives to try and modernize the government. And they've been really accelerated by the pandemic. The pandemic forced us to take services online and digitize things and so on, and Paul's played a leading role in that. So I really rely on him as a member of the city's executive committee and as the chair of the very important committee on general government that has a lot to do with every aspect of your life, whether you know it or not, in terms of your dealings with the government. So I'm here to answer your questions and to listen to concerns you have about the city government and about COVID, and off we go. And thank you very much for the chance to say a few words and for allowing me to join you tonight.
Thank you, Mayor Tory. Mitzi, would you like to say a few words before we start?
Absolutely. It's really great to be here again at our virtual town hall and to welcome our special guest tonight, Mayor Tory. This is the way that we connect with the people in the ward in the riding of Scarborough-Guildwood, and it's an opportunity to hear directly from elected representatives. So to have you here to spend the hour with us is truly just really terrific, because we know that, you know, people do have concerns around COVID-19. They also recognize that Scarborough remains a COVID hotspot where the virus has consistently had a presence since March. And so there really hasn't been true relief for the people of Scarborough. So I think tonight's conversation, we want to put that lens on things in terms of what we can do in our community to, you know, flatten this virus and make sure that Scarborough comes out of the pandemic wave. We can thrive, you know, first from a health perspective, but then also that the economy and way of life here in Scarborough is going to do well post-pandemic. So I think tonight's conversation will be a really great one. Really thrilled to have you here and for you spending your time with us.
Excellent. Well, we've been, Mayor Tory, we've been advertising the town hall now for just over a week. We had one last week with Dr. Elizabeth Buller, the CEO at Scarborough Health Network. So we've got lots of questions coming in. The first one for you, Mayor Tory, which we have been hearing a lot about as the numbers are going up. And this question is from a resident in Guildwood asking about Toronto Health and how they can do a better job at contract tracing. And if they are, why isn't the data being reported in a better manner?
I will say I think the communication of you know, where cases came from and the background behind people catching COVID-19 has been a subject of some confusion out there. But let me go back to the beginning of the question, which has to do with contact tracing. We went during the course of the pandemic from 50 people doing that work, because of course they do it day in and day out on things like, it sounds obscure, but like tuberculosis and sexually transmitted diseases and so on. So they have a contact tracing group of people who do this all the time. But the group quickly grew as the pandemic grew from 50 to 700 people. And the 700 people are not just people taken off the street, as it were. They're nursing students, they're nurses, they're people who have some degree of medical training and some degree of investigative, experience. And there reached a point, though, when this fall, earlier on, when the pandemic was growing at an exponential rate in the resurgence, where they simply couldn't keep up anymore, even those 700 people, with following the full sort of contact tracing routine with every single case. And they found with some of the testing issues that were out there, where test results, I think, as you know, were sometimes 7, 8, 9, 10 days backlog, that by the time they would get started on somebody who had a positive test, making all the calls, to determine everybody they were in contact with and so on, it was almost, kind of out of date to be obtaining that information. So they went at that stage to a method of contact tracing, because they're still doing it, that is consistent, by the way, with what is being done pretty much in every other part of the country, where they prioritize it and they deal with the highest risk people as a first order of business. And other people then are informed that they should track down some of the people they've been in contact with and try and draw that up into a history, but they're people that are deemed to be much lower risk. And this is a practice that is a standard public health practice. It has been engaged in elsewhere, in other parts of this country where they've had high numbers of cases. There's obviously a desire to return to full contact tracing, in the sense that every single case that's tested positive gets contact traced in full, but that will happen when the period of the highest risk passes. And we're in the midst right now of talking to the medical officer of health about additional resources we might get. For example, she's got 200 more people coming from the provincial government. They're in the midst of being trained and coming now. They're kind of halfway through that process. And so that will help to expand the group of people who get the full contact and expand the group that can be deemed to be higher risk. But for the meantime, a sensible decision was made to test the higher risk people and to return over time, as it permits the circumstances, to the full contact tracing. And I will confess that we have to do a better and better job of reporting on the results of that, so people know how people are getting the virus and so on. And that's a work in progress.
Yeah. And I think the other thing, Mayor Tory, is that around the training and making sure that people are properly trained, because often when people are asking about contact tracing, that's a key component of it. I have to explain, you want people properly trained, that, in the middle of a pandemic, you want to make sure the results are being done properly and the testing's being done, and we get the results back as quickly as possible.
That's right. That's exactly right. And the training takes about 2 weeks. And so, and again, you're starting with people who have most of the time some degree of, say, nursing education, so that they will understand some of the health issues. But if you had people that weren't well trained doing this information, you would get poor quality information. And I think there have been some real issues with the testing. Let's not overlook that. And that has resulted in a backlog and information coming back slowly after people get tested and so on. I think a number of you out there watching probably have experienced this. But having said all that, I think they're doing a very capable job, and I hope they'll return to full contact tracing for everyone that tests positive as soon as possible.
Excellent. Thank you, Mayor Tory. And so our next question is actually to myself and partially to Mitzi. It's a two-parter. It's around seniors receiving a double dosage of flu vaccine. And also they have want to know about mobile flu shot clinics being set up. And I know from, in terms of double dosages with seniors, when you make your flu shot appointment, whether it's at a pharmacy, health clinic, one of the clinics that we've set up here in the city of Scarborough, they do track it by date of birth. And if you are a senior, that's when you would automatically be receiving a higher dosage of your flu shot. So it's tracked by date of birth. And then, Mitzi, they were asking about mobile flu shot clinics, which I know was brought up in our town hall last week as well.
Sure. There's a lot of questions around the flu shot, and the reality is that Ontario ordered many more dosages than in previous years in anticipation of a higher volume. However, the demand, perhaps because of COVID, has really outstripped the supply, and so there is no mobile flu shot clinic per se that is being offered. As Councillor Ainsley has said, there is Toronto Public Health has set up a vaccine clinic at a flu shot clinic at the Scarborough Town Centre, so people can go there. There's also flu shots that are sent to not only to public health units, but also to your doctor, to hospital clinics, and also to pharmacies as well, and also community health centers. So there are a number of different options, and really the best advice is, if you can't go to one of these clinics that are available, definitely contact your primary doctor to schedule an appointment for a flu shot. Also, local pharmacies, although many of them have run out of their supply already, they are taking appointments, and then you can get your flu shot. Remember, it is very early in the season, and we will continue to replace those supplies as the shipments come in. And what's important is that everyone stays as safe and as healthy as possible during both the flu season as well as the pandemic that is with COVID-19 that is still circulating in the community.
Yep. Okay, great. Thank you, Mitzi. And I believe your turn, Mitzi, to ask a question of Mayor Tory.
Yes, Mayor Tory. So I have really the question that many people in Scarborough ask all the time, and that's a question around transit. And, Mayor, we know that there are many transit programs that are underway, and we certainly look forward to those. But when it comes to Scarborough, what we really want to see is a complete transit network, and that includes the Eglinton East LRT project. It's something that's been talked about for a while, but we're just unsure about whether or not that's been formally made a priority of the city, and if there is funding that you're working on to support that project. We do recall that there was at one point a transit levy that was earmarked for Scarborough Transit, and we just want to, I guess, be reassured that those investments will be going into Scarborough, and that LRT will be a priority that is built. You will know, that Scarborough has huge geography. It's a very large part of the city in terms of its geography and also the population, but doesn't always have the services that we need. We appreciate the dedicated bus routes. It goes right by my office, actually, on Kingston Road. So, I know that's going to speed up services on one of the busiest routes, but we also do need some of that rapid transit built as well that connects the university and other key places in Scarborough. So what do you have to say about transit and those priorities?
Well, I suppose beyond what I can say, the better evidence of my commitment to trying to get this done is what I'm doing about it. And last Friday, literally just a few days ago, one business day ago, I was in my office meeting with the Federal Minister of Infrastructure, Catherine McKenna. And at the top of my list for discussion with her was our interest in getting the Eglinton East LRT built. And this will cover a number of the questions that you posed in giving you this answer. There was collected, specifically for the Scarborough subway, a levy that was collected for a number of years, and it's resulted in hundreds of millions of dollars being notionally available in an account. When I say notionally, there is an account that says that money that's been paid in for the purposes of building the Scarborough subway is still there. Nobody's spent it or touched it or done anything with it. What did happen, of course, is that the provincial government took the responsibility for paying for the entire cost of a subway they modified to extend it to 3 stops. And said that with respect to the money that we had otherwise accumulated from the City of Toronto taxpayers to build the Scarborough subway, that we could use that for other transit priorities, but provided we could satisfy them that we had looked after state of good repair requirements for the transit system, because the transit system had over time, not when I was mayor, but at over time accumulated a huge amount of state of good repair issues, some of which are being dealt with at present and many more to come. So I would just say to you that while there has been no decision made about anything to do with that money, it's just there, that it is, I think my own view on it would be that it was collected both in terms of the letter and in the spirit of how it was collected. It was collected for transit in Scarborough. And so it would be my strongly held view that it should be applied to transit in Scarborough. And of course, the number one project that we would have some financial responsibility for, since the province is paying for the entire cost of the Scarborough subway extension, the Bloor-Danforth subway extension, would be the Scarborough East, Eglinton East LRT. Up into Malvern and through the U of T campus. And of course, I will not recite all the reasons here why, as I did to Catherine McKenna, the federal minister, why this is such an important priority project. But I think the people out there watching, I think it's 7 what we used to call priority neighborhoods, neighborhood improvement areas, U of T Scarborough campus, the Malvern community, and so on and so on. There's 100 reasons why this is a good project. I told the minister last Friday that this was one of 2 projects that are not included in Premier Forward's present transit plan, and the other one being the waterfront transit. And the waterfront transit, I think, has more of an opportunity to finance itself by different means, say through the Federal Infrastructure Bank or something like that. The Scarborough Transit, Eglinton East Transit, will have to be probably funded in more conventional ways. And I basically said that while I would hope to get the province in, and that's going to depend on you folks out there putting some pressure on your Conservative MPPs to say that Scarborough, as Mitzi said, does deserve its fair share of transit, including the LRT, but that I felt between the pressure being applied, and you all should know, again, John McKay is not here, but John McKay and Gary and Salma and Bill Blair, and I'm forgetting somebody I know, but they
Gene Yip.
They have applied relentless pressure on their government to make the Scarborough East, Eglinton East LRT a priority project for them to fund as well. So if you took the money we have in the notional account, you applied all or most of that to this project, and you took some funding from the government of Canada, I think we could get going on this. And so it's a priority of mine. I told the minister it was an urgent priority. In other words, I wasn't talking 6 years from now to get going on it, that I want to get going on it soon because we need it. The people of Scarborough need it and deserve it. And so I will just tell you, as recently as Friday, it was a work in progress. I will continue to work on it every chance I get, as I know will the federal MPs. We'll have to go to work on those provincial MPPs, but I think they'll get on board too.
Thank you, Mayor Tory. It's really great news. And I know that you have just strong support of your city councillors, Jennifer McKelvey, Paul Ainsley, and others as well. And we just want to see Scarborough thrive and flourish and to be a connected part of this world-class city that you lead and that we are all a part of. So thank you so much. If there's anything that I can do to continue to help to support transit improvements, I will always do that. This is a community.
Ask me a question in the House about it, seriously.
Yes.
But, and I should, I was sort of taking for granted that the people would know that Paul Ainsley and Jennifer McKelvey at kind of, in a way, both ends of the LRT, not exactly at the ends, but, they are big supporters of this. I mean, the city council, there will not be an issue. The city council had approved this project once before, way back when. That's not the issue. The issue is getting the support of the other governments, and we actually unusually have collected the money for this too, for a project in Scarborough. So I think, but Paul and Jennifer have been terrific, and all the city councillors from Scarborough and many across the rest of the city, because they know Scarborough needs this.
Yeah. Well, thank you. And I'll definitely take that back, Mayor Tory. Thank you so very much.
Thanks, Betsy, for that question. And I think, Mayor Tory, that people also need to understand that while we're fighting very hard and advocating for the Eglinton East LRT, we've been we put a new bus route on Kingston Road from Victoria Park to University of Toronto Scarborough, morning and afternoon rush hour, which we opened about a year and a half ago, and I understand the ridership is doing very well. I get compliments about it all the time. We have a rapid bus line that we run from Kennedy Station to University of Toronto Scarborough. And the big news just recently, we understand how the large volume of people that do travel from Kennedy through those 7 neighborhood improvement areas. And it was the first route we put in place for rapid TO.
In all of Toronto. Yeah, and you know, I think, Paul, as you were pointing out, I think there were 12 bus routes that use parts or all of that route, and they're now going to move faster for all the people that are on those buses going wherever they're going in Scarborough. I think there's 12 different bus routes that use that rapid TO, and it's the first of its kind in Toronto. And I know there have been some debates about bus stops, put it in and take it out, and there's been some lobbying by you and other councillors to address some of that. But I think it's going to be a big success because it's going to move large numbers of people on buses faster in the traffic, and I think it's going to be a big hit. And I appreciate the patience and the cooperation of course, the members of City Council, but I'm really speaking about the people of Scarborough who've been very supportive of these kinds of initiatives. But you know, the big ones are the subway and the LRT. I get that. Subway, Premier Ford is moving forward with, and they are moving forward with it. And the LRT, we're going to move forward with. We just got to get the feds on board, and hopefully the province too, but feds for sure, and we'll get on with it.
Yeah, and I think the third project, Mayor Tory, is the downtown relief line. I know that a number of people in this area that work downtown in the lower part is the downtown core, and you know, using the downtown relief line to bypass the Bloor-Yonge intersection, or bottleneck, as some people refer to it, is going to be a big help as well.
Yep.
So lots of transit going on in Scarborough, and Yep. Mayor Tory, our next question is from Mr. Patel up in Seven Oaks in the north end of Scarborough-Guildwood. And this has a lot to do with the restaurant and food sector that we've been doing everything we can to support. But Mr. Patel used the example of New York City, and they've capped their commissions on food delivery service at 15%. I was wondering if the City of Toronto would be doing the same type of capping on food delivery.
Well, first of all, I should tell you by way of late breaking news that Minister Freeland, the Minister of Finance for the federal government, introduced her bill to help restaurants today with their rent and with some of their expenses during COVID time. And I think it's a program that's going to go a long way to help a lot of restaurants. So people should know the federal government is stepping in there. They had announced the program, and today they introduced the legislation. I think they even hope to have it passed this week, and it will be of great help to a lot of the restaurants that you're concerned about. On the subject of the delivery fees, I should tell you that I wish, and I've said this on radio and TV, some of you might have seen me saying it, if I had the power, or if City Council did as mayor, I would have been leading the charge, and I'll bet you with the full support of Councillor Ainsley, and I know Councillor Michael Ford, to cap these fees. Because frankly, taking 30% off the top for a restaurant that's struggling to stay alive when they're delivering a meal to somebody is just not fair. Now, I should tell you, first of all, the city doesn't have the power to do that. In the United States, some cities do, New York, San Francisco, and they've done it. We don't have the power. Any capping of fees like that would have to be done by the provincial government. We passed a motion unanimously, of which Paul Ainsley was a part last week, and me, to ask the provincial government to do that. Now, I should tell you, in the meantime, while the provincial government considers that, you should know, and you can look this up, Skip the Dishes and DoorDash have both reduced their commissions. They haven't taken them down to zero, but they've reduced them and give people a pretty good deal. The company that has been refusing to do so utterly and completely is the market leader in Toronto, which is Uber Eats. I talked to their senior executives last week. They have a number of new products that are a bit cheaper on the commission side for the restaurants, but they're not the full service. People take their biggest product by far is the full service, where you use the app to order and have it delivered and so on. And so that one they've stuck at 30% on, and they seem to be, frankly, even after I spoke with them, quite unyielding on that. I spoke today to the CEO of Skip the Dishes. They're very proud of the fact that they have substantially reduced commissions here in Toronto during the height of the pandemic. And DoorDash has actually formed a partnership with the city and Ritual One to help you get I think commission-free delivery during the course of the period, I think between now and the end of the year. So I would urge you to speak to your provincial MPP if you want to see them cap these fees, which the city cannot do, number one. And number two, if you're going to use a delivery app, use Skip the Dishes or DoorDash. And I'm not a shill for either one. I'm just saying to you, if you're looking for companies that have shown some empathy for the restaurants that are their customers, from which you are ordering to try and help them out, then you should patronize the ones that are charging a lower commission so that more of that money stays in the pocket of these restaurants that are struggling so hard to stay alive.
So, Tory, I just want to say I would welcome residents writing to me to continue to push the provincial government to do just as you have said. My colleague, Amanda Simard, was really the first in the legislature to ask the question, and then has been persistently asking for many months to cap those fees because, it has happened in other jurisdictions like in New York and not here in Toronto during a pandemic. In fact, Uber Eats raised their fees during the pandemic, which is the opposite of what was needed. And so we will continue to, as opposition members, to push, hopefully in the budget that is coming up this Thursday, there is some decision being made on that because it is a big issue that has been tabled already in the legislature by my colleague and others.
Thank you.
And in fact, the motion from Toronto just adds that much more emphasis in the need to do it.
I hope it helps.
Yes.
Excellent. Thank you. Our next question is for Councillor Ainsley. What is the difference between dining in a restaurant, outside on a patio, or in a tent? And I'm going to thank the question from the Bendale area for this. It's a question that I get quite a lot, and I'm sure that Mitzi and the mayor get a lot. I know we've had a lot of concern from the restaurant industry, especially when they were unfortunately had to close in the spring. In the latest stage, we had to take a step back on in restaurant dining, and restaurant owners reach out to me all the time, and first and foremost, it comes down, as many of you know, to the droplets that hang in the air, and that's why we encourage people to wear masks, to stay 6 feet away from others, because the droplets do hang in the air. And people need to be wearing masks. And the bigger dangers for those people congregating inside, especially in a restaurant setting where you're eating, you have to take the mask off. It might not always be very well ventilated. So the risk is higher in a restaurant setting. And I've also had bar owners reach out to me, and I've had to say the same thing to them. And also, Dr. Davila in City Council last week spoke about the fact that if you're in a restaurant, you're eating, you're drinking, people seem to get a little more lax around wearing a mask, as opposed to a grocery store or a retail setting where you go into the grocery store, you're always wearing your mask, and you leave, which it's a different scenario than sitting in a restaurant. And the similar with tents on patios. Dr. DeVille and the health department have come up with a very stringent set of guidelines. We don't want people in a tent completely enclosed on a patio, because it's very much like being indoors. It's a contained area, and the risk of the droplets hanging in the air in an area where the air's not flowing through is much greater. So I want to thank the resident for that question. And next we have Mitzi. We have a question about why did the province decide to close indoor dining but not other indoor activities such as schools? What indoor activities are permitted at this time? And they also, the second part, Mitzi, they wanted to know, you also described Scarborough as a hotspot, and I'm not computer savvy. So is there a simple way for residents to find out which neighborhoods are hotspots?
Sure, thank you. First of all, I want to recognize the work of our public health units, and Toronto Public Health with Dr. Davila, and I know, Mayor Tory, you do the daily updates every day. I'm actually wearing a scarf as a nod to Dr. Davila, because I just really believe the vigilance that you're providing, and taking bold steps, collecting the data on the hotspots and making it public was something that Toronto Public Health led that process, and the disaggregation of that data, so we can see who is most impacted by the virus. And we recognize that places like Scarborough were having persistent issues with the virus. Some of it related to the fact that there are many personal support workers, frontline service workers in the community, nurses and others who maybe be transit drivers, and also the density in Scarborough. So there are many, apartment units in our community where it's more difficult to isolate, and even if you do have the virus. So there are many different concerns, and the best way to find out what's happening and to see what the virus is doing is to go on the Toronto Public Health website, and that's what I do. I take a look and see how our community is doing. You may have noticed, for instance, Woburn has been quite a hot spot, and we've been able to get the Scarborough Health Network to do 2 mobile testing clinics in Woburn, and just bringing the testing capacity closer to where people have the need. There was also one done in Guildwood as well at Laurier Collegiate, and there will be many more. It's a question that my staff and I ask the Scarborough Health Network all the time. When are you coming back to the east end of Scarborough, because we need more testing, and they're doing a really terrific job. So to get to the first part of the question around the closure of restaurants, which I think Councillor Ainsley has really very well explained the potential for the transmission of the virus there, and the fact that the data that public health collects shows that that's definitely a transmission risk. For schools, there is also a tracking of schools, and it's posted on a daily basis, the number of cases in schools. I looked at the list today, and I am concerned because many of the schools in Toronto District School Board, at least, are in Scarborough, where they have outbreak that is happening and being tracked, and of course that's a reflection of the virus in the community. So it therefore gets into the schools either by staff or by students themselves, and so we have to be extremely careful. But at the same time, when you think about how children and youth are affected by this pandemic, we have to think about their needs in terms of learning, their growth, their overall well-being, their development, their mental health as well. And school is a very big part of their life. So what has to be prioritized is those overall needs. Yes, we must contain the virus. We have to take steps to do that, such as the province has made wearing masks mandatory in schools when students are there, and there's also a screening process, which is perhaps how many of these viruses infected is being caught as well, so it doesn't circulate amongst the whole school when someone is infected, and we have to take precautions, but at the same time we have to prioritize those learning needs of students, and that's really what we're doing. I'm hoping that there will be more investments. It's something that I have asked for areas that are hotspot areas like in Scarborough, so that more resources can be brought into our system in terms of reducing class sizes. For many parents in Scarborough chose to have their child go the virtual option. But even in choosing the virtual option, we need to make sure that people have devices, that they have access to data to connect to those devices, and some of those services and those supports are still needed. So I really appreciate your question. And I hope you see the reason why we still need to find ways of having school even through the pandemic. The Catholic Board, Toronto Catholic District School Board, came up with a creative idea of having outdoor learning. They've put up tents outside in some of their school locations, and they're delivering classroom learning that way, which was done before. It's not it's not brand new, but we are trying it now to make sure that we keep that learning happening for our young people.
Okay, excellent. Thank you, Mitzi. And I would also like to remind people that on the municipal side of things, the Toronto Public Library has also offered a number of branches, including the closest one to us is the Port Union, at the Port Union Community Center, to classes in local schools for additional learning space as well. And at this point, Mayor Tory, I would like to acknowledge Councillor Jennifer McKelvey is also watching this evening. And we both work very hard.
Does she get to ask you tough questions, Paul? That would be fair.
Well, I actually got an easy one from Councillor McKelvey. She wanted to know where I got the City of Scarborough flag from that's hanging on the wall behind me.
And what is that? I want to know too.
It looks nice. It does.
I'll tell you. Well, it actually came from former councillor Glenn de Bearmaker. At one point, Glenn had a goal of hanging a former City of Scarborough flag on every municipal building in Scarborough. John, he felt there should be a former City of Scarborough flag on everyone, and then he gave one to each of us on Scarborough Community Council. So I'm using it for my backdrop this evening, but I'm sure we can get more of them. Our next question for Mayor Tory, and this one another follow-up on a discussion we had last week at City Council. Lockdowns have created a mental health pandemic. There's incidences of depression, anxiety, alcoholism, drug abuse, suicide have all skyrocketed, and people feel unable to connect with others. What additional mental health resources have been introduced to overcome this clear case of the cure being worse than the disease?
You know, I am very sympathetic to that question, because the questioner is right that it has become something that has been, in a way, more prevalent perhaps even than the number of people who've actually got the virus. A fear about the virus or an anxiety about being cooped up during all that time in the winter. And again, now to some extent, seniors being on their own, I think has caused some grave issues for people. So what have we done about it? We've done two things, but neither of those two things I'm going to advertise to you as being enough to sort of say that we've addressed the issue, because frankly, it's not the city's responsibility. And I don't mean to sound like a buck passer in saying that, it's just a fact, and I'll come to that. Two things we've done. First, we set up an unprecedented helpline, which wasn't just one of those places where you would call and then they'd say, yes, based on what you told us about yourself, you should call this number. They would actually, what they called, hot transfer you directly to somebody who could help, and you dialed 211. And we had mental health support agencies organized and contracted with us to help people generally, but also to help very specific groups like Indigenous people, women, LGBTQ, and so on, who had particular stress-related issues, mental health issues or concerns during the pandemic. And that is still there. You can call 211, and by hot transfer, I mean they will put you in touch right away with a person who will speak to you on the other end of the phone. Now, I realize that's of some value to many people, and there's been lots of use made of it, thousands of calls. The second thing we've done is we have used what is called the Community Support Investment Program, a provincial program where they've granted certain monies to us, which we in turn are to grant out to community organizations. And we have used some of our money to help mental organizations like Taibu and others that are helping people with their mental health challenges, some of the Indigenous organizations and others, so that we've made available some funds in that regard. But in the end, on the broader issue of mental health, which isn't just during pandemic time, but it's very acute right now, we are a long way from where we need to be. It's interesting. I said this right to the Prime Minister. I've said it to the Premier. I've said it to the ministers provincially, including Minister Tobolo, who's the Minister for Mental Health. I talked to him just last week. And I said, the federal and provincial government signed a multi-billion-dollar 5-year deal to help mental health. And you'd be hard-pressed to name very many of the programs that have been funded by that $5 billion so far. And I said that right to the Prime Minister, because I was very concerned the money just wasn't being invested in mental health. Now, Mr. Tobolo made an announcement a couple of weeks ago for $175 million. I don't mean to dismiss that, but at the end of the day, $175 million in a province of 14 million people where many, many, many of them have mental health needs is not adequate. This is one of the great scandals of our generation, not just one government, but going back over time, there's just have been inadequate resources devoted to mental health, which after all is part of the healthcare system. It's an illness of your brain. So would they say to you, if you had an illness of your heart or an illness of your lung or your kidney, well, I'm terribly sorry, we don't have enough programs to look after you, and maybe you should just go home and tough it out? Of course they wouldn't. And so that's what we're sort of doing with people in so many words mentally. So during the pandemic, we've tried to provide this extra help through 211 and through the grants to the community organizations. But really what's needed is a substantial investment in the mental health system as part of the healthcare system. Put that $5 billion to work in a visible way with treatment programs and therapies for people and so on, and do it on a widespread basis so that you can make a meaningful dent in what is a huge problem out there, even before the pandemic.
Yeah, and I think, Mayor Tory, when we talk about mental health, then it goes into children's services and some of the medical services. I think a lot of people don't understand the cost shared mechanism or processes that are in place, and they expect us to deliver a service that's ultimately downloaded on us by the provincial government in a cost shared manner, which means they pay 60 cents of every dollar, we pay 40 cents, but often it ends up being capped. And as the cost goes up, there's an imbalance, and we end up paying more than our fair share of a service that's down.
And Paul,
loaded on us.
I know you agree with me as a city councillor, and I'm a member of council too, the head of the council. Neither of us mind a bit the city being asked as the level of government closest to the people to deliver those services. But the Constitution clearly says healthcare, province. And so, we'll deliver it. I think that's the more efficient way to do it. And there's a lot of argument to be said that we're very sensitive to and very close to people, but they have to fund it, and not in that kind of way that Paul accurately suggested, where they give us some of the money, cap that, and then no matter what the demand is, they just say, we gave you your money. And it's just not right. It's not fair. It's not workable. And it's leaving a lot of people literally on the street in some cases with mental illness, not able to be looked after because there just aren't adequate treatment programs that should be part of the healthcare system, just like those people who go get their hearts and their kidneys and their lungs looked after. It's an illness of the brain.
Yeah. Mayor Tory, Paul, if I can just say, I hear your passion for this, and it's something that will join you in pushing the province to make priority, but also to deliver on the funds really to do the programs that are needed. I was just on a call just before this with Pathways to Education, and some of the young people there were talking about just the rising anxiety and the mental health issues that they are seeing in their peers and the supports that are needed. So it's a big issue, and it affects everyone, and we'll make sure that we join you in that push for more supports.
Great, excellent. And Mitzi, kind of piggybacking on that one, there's a question. Next question is for you from a resident in the West Hill community, and they're asking why there aren't any hospitals dedicated to COVID-19.
Well, this one, Paul, I can answer because there isn't a need. We have enough capacity within our healthcare system to provide the services and to make sure that people have those services and support. So there is not a need for a dedicated hospital just for COVID. You would want to know that in jurisdictions outside of Canada where they've had to set up, say, field hospitals, it's been a very expensive proposition. I know that Liz Buller shared with us on the call last week that in New York City, there's an overflow hospital at the Billie Jean National Tennis Center to provide care, and it provided care to 79 people as an overflow hospital, but it was at a cost of $59 million. So it's very expensive to do that, and we've been able to support everyone that is in need within our existing hospital capacity. We want to make sure that we follow all of the measures that are out there from public health, whether it's physical distancing, making sure that you're sticking with the people in your household and you're not, blending with other households or other people unless you're wearing masks, and doing all of those things, because at the end of the day, maybe it's not just to protect yourself, but it's to protect that elderly person who is in long-term care and our seniors, or that person who has an immunocompromised situation and needs to have that extra protection and that extra support. So that's what we're trying to do here with stamping out the virus. I know the measures, reverting Toronto back to stage 2 is challenging. It's challenging for individuals. It's challenging for business. You've talked about the upcoming, winter. It's going to be challenging then as well. But, we're going to get through this together, and we have to work as hard as possible to keep everyone safe and as healthy as possible.
Excellent. Thank you, Mitzi. Mayor Tory, the next question is for you. It comes from a resident who said he often reads Councillor Ainsley daily e-news blasts. A lot of discussion around pedestrian crossings, intersection light reviews, speed limits, but understands that the transportation services isn't doing any studies right now and has a crosswalk they've been advocating for in their community that was approved but hasn't been installed, and would like to know when transportation services will be starting again in that work.
Well, I have good news, and it's retroactive news. The actual answer to that question is that the studies were started again on October the 1st, unless people think it was because everybody just took the summer off or whatever. We try to make good and efficient use of the people who work in the public service, and the very same people who work in transportation services, who go out and do all the traffic measurement for crosswalks and look at what they call the what's the word I'm looking for now, Paul? The things that are the guidelines,
the warrants,
criteria, the warrants. And they go out and look at all the different things. Normally we have a limit that says, well, you have to have this much traffic or this many pedestrians to have a crosswalk and this kind of thing. So somebody has to go out and measure all that. Those were the same people who were putting in the patios, on the curb lanes of the streets to help the restaurants out. They're the same people who were doing the quiet streets and the active TO downtown where you could ride on Lakeshore Boulevard and so on. So they were very, very busy. And in fact, what they got done this summer was an extraordinary amount of work, but it was done at the expense, to be candid, of the crosswalks and signals and the kind of studies that have to be done. They resumed doing that work because we were taking the patios out and closing down some of these other things on October the 1st. They're going to be catching up on the backlog that has existed. And so they'll be looking at all kinds of parking investigations, the pavement marking requests, studies in the area of schools and crosswalks and signals. These will all be prioritized as things that have to get caught up. And so the work will be done. And I think, as Paul will tell you, Councillor Ainsley, he's certainly been a big supporter of these measures. We've actually made it now easier, if I can put it that way, to have a crosswalk installed or a traffic signal, because we've said that we have to take steps that put the default benefit to the pedestrian and cyclist. And that's not at the expense of traffic being bad. It's just really saying that when it comes to safety, we have to go the extra mile. We've lowered a lot of speed limits. We put in, of course, the automated speed enforcement. So we've done a lot of things to try to keep pedestrians safe, and the work on crosswalks and signals will pick up now that it started again on October the 1st.
Yep, and that's one of probably the most interesting parts of that conversation that I have, Mayor Tory, is when people say, I asked for a stop sign at Galloway Road in Coronation. Where's my stop sign? And I have to explain, well, we have what are called warrants. There's parameters for everything. It's under the Ontario Highway Traffic Act that studies have to be done. I simply can't drop a stop sign in at the intersection, no matter how badly you think it's needed. But as you said, we've worked very hard and in loosening the restrictions around that, speeding up the process, because we are trying to build walkable communities, as we call them. It's not just about driving, it's public transit, bicycling, walking. In a few months, we'll be having a discussion around e-scooters and all kinds of different modes of transportation to build walkable communities and livable communities in Toronto. Mayor Tory, the next question is also for you. It's will the Cafe TO extend to spring and summer 2021?
That will be a decision. I should say, by the way, when I mentioned the quantity of work being done by the same transportation services people that do those studies, they did 1,000 quiet street installations, 711 restaurants have a Cafe TO program. So this is just a small indication of how much was done. I hope the answer to that question about the Cafe TO program is an enthusiastic yes. But in order to follow proper process, as you would expect we all would, I asked that a report be written to evaluate the Cafe TO program and look at the benefits and the costs, if there were a cost of significance, and suggest improvements so that if we re-implement the program next year, as I believe we will and as I fondly hope we will, then we would do it even better than this year. So the answer to your question is a qualified yes. We're going to receive the report, I believe, in December. We'll see what it says about the costs and benefits, but that's really not the issue. The issue is, are there ways you could make the program better and more effective to help restaurants and to help people have a good time? I think the benefit was meant to help the restaurants who couldn't have indoor dining and people felt insecure in indoor dining. But I think the other benefit of it was that people really enjoyed them. They enjoyed even the look of the city with some of these extra patios and the experience of being on them. And so I think the answer is yes, but just with an asterisk saying it's pending the report and pending reapproval by the city council, which I'm sure will come.
Yeah, and I know as a city councillor here in Eastern Scarborough, I'm a strong advocate of the Cafe TO program, and I know Mayor Tory, you went the extra mile because there was provincial legislation that was involved around it, in particular in the suburbs, where we had to have provincial legislation quickly amended so that restaurants that had, for example, a parking lot between their front door and the roadway could have their patio extended into the parking lot. And I have to thank you for going that extra mile for restaurants in Scarborough, going to the province and having a ministerial order asked for so that we could quickly deal with that. Otherwise, it might have been months before we actually saw patios opening this past summer in Scarborough. So I know restaurant owners and bars in Scarborough are very very happy about that we're able to fast track that.
Yep.
Mitzi, as we're getting into the cold months, the next question is for you. The resident would like to know about trails and provincial parks being cleared of snow in light of COVID-19 so people can get out and exercise.
Okay, so I'm actually just on the OntarioParks.com website, and if we could put that in the chat so people can go to that site themselves. It's OntarioParks.com, and all of the latest information is available on that site in terms of the management of provincial parks. There are some changes as a result of needing for people to physically distance and to keep safe, so the parks will have a capacity limit that they will manage on a day-to-day basis. The advice that's given on the park is go during the weekdays. Apparently, they're not as packed during weekdays as they are on weekends. But I know that that we recognize that people need to be in the outdoors. It's actually part of what we're telling everyone. So I believe that there will be every effort made to keep parks open and accessible, but we also have to make sure that they're safe as well and that they're not overcrowded. So my best advice is to visit OntarioParks.com before you go so that you have the latest information of what is happening in the parks, in the provincial parks.
Paul, may I add a word to that about city parks? I was just asked at the media availability today at City Hall about the city park, same question. And I said, we're going to be coming back with a report very shortly because I asked the city staff to augment the normal program of winter activities because of the COVID situation and the fact we want people to be getting some fresh air and being outside and so on. So they will be coming back with some enhanced winter activities in parks and in other public places. And I think we're going to have to do a bigger job of plowing some pathways through the parks that wouldn't ordinarily be plowed during the winter so that people can use those pathways to take a walk. So they'll expect to hear from us on this quite shortly, I would say in the next week or so, just so people know what we're doing as well.
Yeah. Can I also give a shout out to the Toronto Zoo? I just thought that they've done a remarkable and creative job in the East End, just finding ways of using their big space and capacity at the zoo, keeping it animated, keeping it open and accessible, but in a safe physically distanced way, so people can still have that recreation and that opportunity to get out.
Yeah.
Great job.
Yeah, and as chair of the board of management of the Toronto Zoo, Mitzi, I will certainly take that message back. And we have an amazing light festival on right now, Lumina, at the Toronto Zoo. So if you're looking for a very fun-filled evening to spend with your family at the Toronto Zoo and get some exercise, and it's an amazing experience. You can go to the Toronto Zoo website, buy tickets online, and have a wonderful experience. And just stepping back on the pathway issues, the one example that I have, Mayor Tory, at Tuxedo Court, which is at Markham in the 401, last winter I had a request from the residents there, because they have a pathway that goes from Tuxedo Court to the two local schools, which doesn't see winter maintenance. And when you're trying to get children to grade school, sometimes we get quite heavy snowstorms, ice storms, and the children, just don't go to school. They stay in their apartments, which in particular during a pandemic like this needs to be dealt with. So I was very happy to see and hear that report was going to be coming to through Parks, Forestry, and Recreation, because as we said earlier, when we talk about having livable communities, I think we need to look at all aspects of it, and sometimes get out of that box that we're in and look at things from a different perspective. So Mayor Tory, I really appreciate that as well. I think at this point we're drawing to the close of the evening. Mayor Tory, would you like to say a few closing remarks at this point?
I will just say thank you to you and to Mitzi for, first of all, having me on, but also for you being prepared to answer questions tonight for our viewers. Secondly, I will say thank you to the people watching for their patience and for their perseverance and their compliance during the pandemic period. The medical officer of health will say, for all the miracles you can talk about with vaccines and with other things, the most important thing at this stage people can do, since we don't yet have a vaccine, is follow those very basic rules. Wash your hands, wear a face covering, avoid crowd scenes, keep your distance. These are things that are very, very basic, but if everybody actually did it, everybody wore a mask most of the time, and kept distance most of the time, and all this stayed around people only that they lived with, they'd be able to really beat this virus down much faster. So I really hope people can cooperate in that regard. And I will tell you in return, I'll be down at City Hall with Councillor Ainsley, and we'll be trying to make sure that the first and foremost thing we do is to support our most vulnerable residents, which we've been doing during the pandemic. We will keep the city services going so that people can get about their lives as best they can. And we'll be continuing to plan for the future on affordable housing, on transit, and on some of the things we've talked about tonight, including the Eglinton East LRT. So I thank you, though, for your patience and for your perseverance. The people of Scarborough are just good, solid people who are people that do follow the rules and do, kind of want this to be over, as we all do. So please keep up that work. Thank you for that. And I will continue. I visit Scarborough, as Councillor Ainsley, and I think Mitzi knows too. I visit Scarborough every week, I think, without exception, many times, multiple times during the week, because I care, because I've learned a lot, and because I want to make sure some of this stuff gets done. So thank you very much.
Okay. Thank you, Mayor Tory. Mitzi, concluding comments?
Sure. Well, this has been a really great opportunity, and thank you so much, Mayor Tory, for taking the time to spend with us here on our virtual town hall meeting. And our colleague John McKay is not here tonight because he had to be in Ottawa for other responsibilities. But I know if he was here, he would say you have to come back. So I'm going to do that on behalf of him and Paul, saying please come back. We are doing these forums to make sure that residents feel connected during COVID, and that we can answer as many of their questions as possible. And as things change, that they know that their representatives are there. So we invite you back to one of these sessions. And to our viewers who are watching, stay safe. And we know that this is a challenging time, and if there's anything that my office can do, we are working through the pandemic. We're answering phone calls, we're taking emails, and if you do need to see me or my staff in person, we are taking those appointments as absolutely needed. So you can contact me at mhunter.mpp.co, at liberal.ola.org, or call 416-281-2787 to connect with my office. And also to sign up for my newsletter. It's sent out each week as well. We try to provide updates as well for you in that manner. So you can always just send me an email and we'll put you on that list. Thanks very much. Thanks to our wonderful moderator tonight, Councillor Inslee, did a terrific job, and over to you.
Thank you very much, Mitzi. And in conclusion, I just want to say, first of all, thank you very much to Mayor Tory for joining us this evening. I want to thank you for the fantastic job you're doing as our mayor through this pandemic and providing much needed leadership to everyone in the city of Toronto. I'm always very impressed with your careful and very thoughtful responses to questions and the dedication that you've been providing through this pandemic, advocating, as you mentioned, to both levels of government for a wide range of needs here in the city of Toronto. I know the residents can't thank you enough, and I want to thank you as well. To Mitzi, once again, thank you for joining this evening. We've always worked well together. It's unfortunate that our federal colleague, John McKay, can't be here, but I know we're going to continue working together for the residents of Scarborough-Guildwood, having many more town halls, using our e-news, which mine you can find and sign up for on my website at paulinesley.com. To the residents of Scarborough-Guildwood, once again, thank you for all your perseverance during these very difficult times. But I know that as Scarborough residents, we're all going to work hard and be together and see this through to a resolution. So I want to thank everyone once again, and Mayor Tory, looking forward to having you back on one of our future town halls.
Anytime. Happy to do it. My pleasure. Bye-bye.
Thank you. Have a good night, everybody. Stay safe and stay well. Thank you.